Welcome back to PCOS Healing Adventure with me, Dr. Ami Patel. I'm super excited that in today's video, I have a guest with me, one of my friends, Tatiana Alafouzo. And we're so excited that today for PCOS Awareness Month, we're going to talk about a topic that also needs more awareness, which is eating disorders. And we're going to talk about our experience with that. So welcome, Tatiana. Thank you so much for talking about this. Obviously, it's a sensitive subject. So thank you.
Oh, thank you so much for having me. I feel honored to be on your channel and to discuss such a personal thing for both of us and for so much of the PCOS community. So thank you for having me.
Of course. And before we get into it, I just want to remind everyone, be sure to like this video and subscribe to my channel if you haven't already. So Tatiana, can you just give us a little bit background on your PCOS, like when and how you were diagnosed?
Sure. So my name is Tatiana. I am a PCOS patient and a PhD researcher who is currently focusing on mindfulness-based interventions for certain physiological and psychological symptoms of polycystic ovary syndrome. So my own PCOS story is that I was very lucky. I was diagnosed quite early on in life at the age of 14. I had very similar symptoms that most people with PCOS experience during puberty, such as extreme weight gain, like a lot of thinning and hair loss, anxiety, depression, and very, very heavy, irregular menstrual cycles, which were also extremely painful. And like most with PCOS, especially when they're kind of like around this age, I went to the GP several times, sort of, gave them a list of what was going on in my life in the hopes of, getting to the root of what was happening, and was dismissed many times and told that these were just normal symptoms of puberty and that, I would outgrow them. And the weight gain, which was like, honestly, like very extreme, not having changed anything in my diet or exercise routine, probably gained about like somewhere in between 20 and 40 pounds in like an extremely short period of time. I was just told like it's baby fat, it'll come off type of thing. So finally, I was very lucky. My mother took me to my amazing OBGYN in New York City, who did diagnose me with polycystic ovary syndrome and insulin resistance, which, as you're well aware, about 70% of those with PCOS also have insulin resistance on top of it. So I was able to at least have a diagnosis and feel like things were not completely in my head. Like I wasn't, crazy. I hadn't, made all these symptoms up. But then kind of came a secondary situation on top of that, which was that now how do I handle having this, thing called PCOS, which I had never heard of? How do I go about, controlling these symptoms? And like many, including yourself, was told to control calories, control carbohydrates, here's some birth control pills, come back to me when you would like to have some children, which you might never be able to have. So, my story is very similar to most. Unfortunately, that's kind of the situation that we're at with PCOS and many medical providers.
Yeah, definitely. No, that I'm sure many of the viewers can resonate with that story and have gone through similar things, unfortunately. So speaking of your PhD, just want to touch on that. So why did you decide to pursue a PhD on complementary and alternative therapies for physiological and psychological symptoms of PCOS? Is that the full correct terminology?
Yes, no, perfect. So I'm very passionate about empowering those in the PCOS community to be able to take control of their symptoms. As we know, there's not necessarily enough tools in the toolbox that we are presented as PCOS patients in order to be able to, better get to the root of certain things and control, help control certain symptoms. As we know, there is no cure for PCOS currently. And also PCOS is not necessarily considered a public health priority and is not given, the funding it deserves. So I was sort of hoping to, have something that women could add to their, so to speak, like toolbox of PCOS, of things that they could use to help control their symptoms with PCOS, which is accessible and inexpensive and also has proven to work in other populations. So what we do know about mindfulness-based interventions, we don't know necessarily as much as we would like to, but we do know that they have been shown to work and lower blood pressure, blood glucose levels, specifically in type 2 diabetes populations, as well as inflammation. All these things affect PCOS patients in terms of physiological, symptoms and where their roots are. But we also do know that mindfulness-based interventions have had very powerful effects in the psychological, in psychological health. They have been shown to lower anxiety, depression, help with self-esteem levels, and other things which also affect PCOS patients greatly. So there have not been a lot of studies done on PCOS populations. In fact, most have not been. It's very, very few, but those that have been done have been shown to be beneficial. They have been shown to lower blood glucose levels, lower depression levels, anxiety levels, increase quality of life, and also reduce salivary cortisol levels, which, in case somebody is unaware of what that is our stress hormone in our body. So definitely something which has been shown to be beneficial, but not enough research has been done in PCOS populations. So my hope would definitely be to further expand that research, and in doing so, compare and contrast it with the effects of diet, exercise, and medications, which obviously are equally as important in terms of, for those with PCOS. So I guess, I just wanted something, that people with PCOS would be able to access easily, and which has been proven to work. And that could be an additive thing in their life.
Yeah, no, I think, like you're saying, there's a research in PCOS in general, and especially on topics like this. So I definitely appreciate that you're doing this research, and I'm excited to see what you find and how it can benefit us all.
Thank you. Thank you so much.
Yeah, of course. So talking about eating disorders now, the main subject of our discussion today. So I guess a little bit about eating disorders with PCOS. So for some of our viewers who may not know why eating disorders are common in women with PCOS. So a lot of times when people with PCOS see a provider, they get told like, okay, just lose weight. And unfortunately, due to the way the medical system is, the providers don't have time to spend with us and go through the details of how to lose weight with PCOS. They're kind of just like, okay, lose weight, cut carbs, cut calories, cut out other food groups. And that, along with maybe being told like, restrict your calories, or even from family members, or saying like, oh, like, you don't have self-control, other mean comments like you're lazy. Those things like that can cause us to, do different things that are not good for our health, that can lead to eating disorders, trying, restricting too much, which can lead to binging. So those are all the different factors that go into why people with PCOS can experience eating disorders. And, sometimes trying diets that work for other people that don't work for people with PCOS, because our hormones are different, but, we may not realize that. So all of those factors can influence why we experience eating disorders. And Tatiana, I think you had some statistics that you were going to share with us.
Yeah, so absolutely. You hit on all of the very important points as to why people with PCOS tend to develop eating disorders at a higher rate than those maybe without PCOS. Unfortunately, the research with PCOS and eating disorders is quite limited in terms of, numbers, but we do know that obviously those with PCOS have a lower self-esteem, more psychological distress, and are more prone to eating disorders than those without. As you said, this is very much due to a lot of the time based on advice that they're given, which tends to propel them into eating disorders. And so the prevalence of eating disorders in PCOS patients does range from somewhere in between 12 and 36% based on a study that was done in 2018. Most highlighted eating disorders in the PCOS population are bulimia nervosa, binge eating disorders, or night eating disorders. But those are those that have been well documented in the PCOS population. That doesn't mean that there are not, the PCOS patients are not prone to anorexia, or other orthorexia or other, eating disorders, which we will discuss. So yeah.
Yeah, I feel like honestly that number is smaller than I feel like I've seen, but there's just not research. And of course, the number of women that are still undiagnosed with PCOS is also large. So, some of those women may have PCOS, but yeah, definitely.
Yeah, absolutely. I would agree with that 100%.
Would you mind telling us your story with eating disorders?
Yeah, sure. Absolutely. Like I said before, when I was diagnosed with PCOS at the age of 14, I was told to, just the basic advice, cut calories, cut carbohydrates, which definitely propelled me into several different eating disorders. I definitely went through very bad phases of starving, binging, purging, and exercise bulimia throughout my life. I also, this is not playing blame game or anything here. This is just, facts. I also had a mother who had an extremely severe eating disorder growing up, extremely severe anorexia and bulimia. And although she had recovered by the time I was born, I think that a lot of those things are ingrained in you, unfortunately. And even though she always instilled in me to have a lot of confidence and body positivity, I think the way she spoke to herself and the way I viewed her speaking to herself did not help that situation at all, unfortunately. So I think that, like you were saying before, a lot of times we take the noise of what's around us and we absorb it, so much, whether it's told directly to us or whether it's said around us, it's something that unfortunately does seep into our brain and does affect us psychologically, whether we know it at the time or not. So I definitely was, unfortunately, just obsessed completely with food instead of seeing it, as this amazing thing which fuels our bodies. And, instead of seeing the so many benefits of, adding certain nutritious foods to our diet, especially if we have PCOS, which can be extremely beneficial. I saw so much of what I was looking at was cutting things out, and I just did really, really horrible things to my body. I abused diet pills extremely, to a point where it was almost dangerous. I remember once I was on a bus in New York City and I honestly thought I was having a heart attack because I was abusing diet pills so badly that I literally, I don't even know what was in them, honestly, probably things which are currently illegal. But yeah, just, literally feeling complete loss of control. I was literally having a heart attack. I remember this was a very big movement at the time, pro anemia forums, which basically is short for pro anorexia bulimia forums, which are extremely impressionable for teenagers. I know that the internet has cracked down on these more, but however, it's still a massive problem. It's really where people with eating disorders go to support one another, not to recover, but they support one another to continue on in their eating disorder journey, which is completely horrific, and something which needs to be addressed, especially in those in young impressionable teenagers and those with PCOS. It's not normal to be cheering each other on for only eating 200 calories today. That's not a good thing. So definitely went through quite a lot. I mentioned this on my Instagram. I was, exercising 3 hours a day. I was like completely obsessed with scales. Just honestly, yeah. I mean, I could go on even more about it, but it was just a really vicious cycle, and it's very difficult to break. Quite frankly, every day is like still a struggle. So if anybody's out there and struggling, just know that, it's not easy. It's not something you just turn off and all of a sudden one day you're better. It takes years and years of hard work. But mindfulness definitely helped me through a lot of it. I will say that much. And I'm not saying that just to like, tout my own research or what I'm looking into, but, it has been shown to, it has been shown to help a lot in eating disorder populations. Whether that's whatever eating disorder that is. So, because it does help get to the root cause of what your eating problems are, which a lot of the times don't necessarily have to do with food, have to do with feeling like you need to have a sense of control in your life, which a lot of times PCOS patients feel that they do not, because so many of these symptoms are kind of happening and you feel like you have no idea exactly how to control them. And so you decide to go to the extreme. So that's kind of my story. With an eating disorder.
Yes, I didn't know there was forums like that like promote, or I guess like you're saying, encouraged each other to have that eating disorder. So I didn't know that. And I'm glad that, like you said, it's been better and those forums are being, closed down and all of that. So that's good at least.
Yeah, definitely. We're in a better position with that, I think. But I think also not that I would necessarily know nowadays, but I think probably I'm sure that in these days of the internet, people are finding some underground ways of doing these things, which is also not good. So
definitely.
The internet is like a great thing and a bad thing, when it comes to so much. Social media is wonderful, but social media does also promote a lot of, crazy behavior from so many different people, whether that's, extreme dieting or cutting out so many different food groups or, extreme exercise or whatever. But it also is like a wonderful place for people to come together. So.
Yeah. And that's how we met, which was great.
Yeah, exactly. Exactly. So I'm super, super grateful for social media to have brought me to you and to so many other amazing people. But yeah, it can be dangerous, especially with, impressionable teenagers or those who literally have just been diagnosed with PCOS or other, disorders and don't really know where to turn to. And there's all this misinformation and it's really horrible. So.
Definitely. Well, thank you for sharing that. I want to share a little bit with my experience. So I think, like you were saying, we usually hear about bulimia, anorexia, binging, nighttime eating, but something that I experienced was orthorexia, kind of going along with what you were saying. So orthorexia, for those of you that may not know, which I didn't even know that I was experiencing this, is basically when you're like obsessed with eating clean or eating like too healthy or just being too healthy. So for me, I was diagnosed with PCOS at the age of 23. And so all through my 20s, like I had started gaining weight because of the PCOS and insulin resistance. But of course, at that time, I didn't understand insulin resistance or anything like that. So I was going on a bunch of diets, on and off. I was trying to restrict calories. I have a family history of diabetes. So I was I'd go through phases where I'd be like, okay, for the next 90 days, I'm not going to have any sugar, things like that. I would try to do like challenges with my friends that don't have PCOS. So they would get results and, I wouldn't, which would make me feel bad, of course. And then, doing like over restricting would lead to binging phases. So the worst of my PCOS symptoms was like about 3 years ago in 2018. And at that time I gained about 20 pounds and my symptoms were at their worst with like the hair loss, acne, and trouble losing weight, anxiety, and depression. And I was, at that time, I still didn't really understand PCOS or what it was. I just knew I had it, and I thought I was fine because I was taking birth control for 5 years, 4 to 5 years at that point. But my husband kept telling me I think the things you're experiencing are due to PCOS. And I was like, you don't know what you're talking about. I'm on birth control. I'm fine. But, he kept telling me no, you're getting mood swings, or your sugar cravings could be from PCOS. So I was like, fine, whatever, go to Google, start looking things up, because I didn't really know any better. And of course, it says on there, lose weight, lose weight, lose weight. And then you see the list of list of foods to avoid, don't eat bananas, don't eat corn. I'm like, oh my God, these are foods I love. And then I was like, okay, whatever, maybe if I lose weight, things will get better. And then, of course, the app, MyFitnessPal, which I extremely hate now, is telling me, okay, you need to eat 1,300 calories to lose weight. So, I started doing that. I would log everything on the app, every single thing, how many, if I ate a salad, how much quantity of tomatoes I ate, or, silly things like that. But at that time, I didn't realize that it was silly. I was just obsessed with staying within my calories. If I was gonna go to a social event or go out to eat, I would look at the menu ahead of time and be like, okay, this is what I'm gonna eat. This is the calories it's gonna be for me today. So for the rest of the day, I can only eat these calories. And at that time, I didn't think that any of it was an issue. But then I also saw a couple of providers, like an endocrinologist, and they reviewed my labs, and then they called me with the results, oh, this is your insulin level, et cetera, et cetera. So I asked them okay, what should I do? And, in the 2-minute phone conversation that I had with them, they tell me okay, limit your carbs and your sugar. Okay. And then OBGYN that I saw, she also told me you should really stop eating gluten and dairy for PCOS. So it's just things like those conversations with healthcare providers, which I know they may think that, it's for our best intent, or, best for our health, or they're giving us their advice. But I think words like that can affect everyone differently. And I think it's easy to say, cut this out, but what someone goes through to try to change that lifestyle overnight and, implement those things takes can impact your mental health a lot. So anyways, I was trying to implement these things, and I didn't realize that it was really an issue. And then I was listening to a couple podcasts, and somebody mentioned orthorexia, and I was like, holy cow, that's what I'm doing. And I didn't even realize it was a problem. And then I really had to step back and evaluate everything I was doing. And I, started to realize, I looked more into the eating disorder and realized that, this is actually really an issue. And at the same time, I was still learning more about PCOS. And I started to realize that, PCOS is a lifelong condition, and I cannot eat 1,200 calories my whole life. And I don't want to eat 1,200 calories my whole life, right? I don't want to not eat carbs or not eat sugar or not eat gluten or dairy. And so for me, it was really the mindset shift in realizing that PCOS is a lifelong condition, and I don't want to be, living like this, or, not enjoy social events or not go out to eat, and just basically be obsessed with food, like you were saying as well. So for me, that was the major mindset shift that helped me kind of get past that. And at times restricting too much led to binging. So those were my struggles. And, like you said, it's not easy, and it doesn't just happen overnight. I think there are times where I still feel like that, sometimes where I'm and I think that's the fine line. It's really hard to kind of determine when you're managing something like PCOS and, being told to be aware of these things. It's how do you know when it's an eating disorder versus you're just trying to be healthy? And actually, that's one of the questions that someone asked on Instagram for us to talk about. I don't know if you have any thoughts on that before I share my thoughts.
Well, first of all, I just want to say thank you for so bravely sharing your story. It's definitely, like, unfortunately, all too common in the PCOS community, and really in general, to think that you're, you're doing something beneficial for yourself, and in the end, it ends up being harmful because you're literally just like completely obsessed. And I think that's something that's so difficult, is that we attach so much morality to food in general, when food really shouldn't have a moral, attachment to it. Food is not good or bad. Food fuels us. Food is something for us to enjoy. Food is something for us to use, as a tool when we celebrate. And it has so many, like, amazing benefits, not just like for our bodies health wise, but also socially. So many of, like, our best events in our life happen around food, right? So the fact that you felt the need to have to control that much is really heartbreaking. So I'm so sorry that you had to go through that. In terms of this question from Instagram, I do have a thought. I just want to sort of say that, well, first of all, it's a very difficult question, and I'm not an eating disorder healthcare provider. So if you feel that you are suffering from an eating disorder, please do reach out for help. I know that for me, it was definitely a multidisciplinary team that was required in order to kind of get to the root of it, and in order to sort of help deal with it. So that involved psychologists, psychiatrists, and dietitians, not just, waking up one day and feeling like, like we said, that everything's all, hunky dory. Because a lot of times it does require getting to the root of what this, why this is happening. And that's like a very long process, which could take multiple professionals to help get to the root too. So that's kind of my 2 cents on that question.
I agree. I think one thing I also realized when I was learning more about PCOS and insulin resistance is, I know, the emphasis for PCOS is always like lose weight and diet and exercise, but I think also we have to remember other aspects of it, like, sleep and stress, and those have a bigger impact than, thinking about, oh, should I eat this like slice of bread or not? Like, if you think about all the other factors that go into your PCOS, it's more than just diet and nutrition. Like, you may be eating, you may try to control those things, but they may not have as much of an impact as other things in your life, like sleep, if you're not sleeping enough, or your stress levels are out of control. And also with, restricting too much and cutting calories for PCOS, it actually can add more stress to your body too. And sometimes if you're not giving your body, all the nutrition, it's actually more harmful to your PCOS too, and also, for your mental health that we were talking about. And I think also, like, asking yourself, is my behavior because of an eating disorder, or am I doing something that's beneficial to my health? And, like Tatiana was saying, these are just our thoughts and our experiences. We're not experts in this, we're just sharing our experiences. But I think, asking yourself, like, are these choices I'm making a sustainable lifestyle for me to have for my PCOS? Because, PCOS is a lifelong condition. Am I happy not eating these foods? Is this behavior causing me to binge later? Am I embarrassed? Or am I like hiding when I'm eating certain foods? So I think if you ask yourself those questions, that might help you realize that, what you're doing is not really the best for your health and your PCOS. And also, there are some resources that we both recommend. One is, which I'll include them in the description under this video, but the National Eating Disorder Organization, their website, nationaleatingdisorders.org, they actually have a screening tool on there that you can, answer some questions, and they can, recommend when they think you should, seek professional help, which I think is really helpful. And then there's a website from UK.
Yeah, so we have here in the United Kingdom, we have eatingdisorders.org.uk, which is also very helpful. Also, I just would like to add one thing to what you were saying before, which is also very, very helpful. Yeah, you're right. I think also if the behaviors interfere with like just your everyday life in general, whether that's hiding, whether that's saying no to social events, not because you don't want to go or because you're not interested in it, but because you're afraid of the consequences of going in terms of, eating what you may or may not encounter there in terms of food, things of that nature, if it's affecting so many different aspects of your life, it's definitely a problem, whether it's an eating disorder, disordered eating, or otherwise. And also, I would just like to say, I know that you're going to be including some, you've said that, you will include some amazing dietitians that potentially help with PCOS, but I would like to give a shout out to Martha McKittrick, also known as PCOS dietitian, because she definitely helped me through my own eating disorder period when I was living in New York City. A lot of things I thought were normal behavior, very similar to what Ami was talking about earlier, which were actually probably a lot of orthorexic behavior, such as logging in obsessively in MyFitnessPal, et cetera, were definitely brought to my attention by her. And we were definitely able to get to a lot of the root causes of that and how, for some people, MyFitnessPal works really well. Like, I'm not here to knock MyFitnessPal. I definitely have my own feelings on it, but, if it works for you, that's fine. If you don't have a history of disordered eating. But for a lot of PCOS patients, it does become a very obsessive and unhealthy thing. So definitely do seek help if this is something that you recognize in yourself.
Definitely. And I think working with dietitians that understand PCOS makes a big difference. Yeah, so I think, like you were saying, Martha is a great dietitian. Emily Badiato, who I actually also interviewed on my channel, she also has PCOS herself and specifically helps women with insulin resistant PCOS. So I think, those are a couple of dietitians that really understand the struggles that we go through as people that have PCOS that can, work with you so that you don't end up with the eating disorder, when trying to get help. So I think those are some really good resources. Also trying, recognizing if you need mental health support and, asking for that and trying to get help for that too.
Yeah, absolutely. And just know that you're not alone. This is like extremely common in the PCOS population. We've both been through the ringer with it, and we are not the only ones.
Yeah, so I think, thank you, Tatiana, for coming on and having this discussion with me. I think that's one of our goals with this video is just raising awareness on the subject so that people can realize, if they're experiencing any of these things, that they may need to get help and that, you're not alone through this. So if you guys ever want to reach out to us, we're more than welcome to talk to anyone to help you guide you in the direction where you feel like, no one understands you. Where can I go to get help? So in addition to those websites, you can always approach us and we can guide you in the right direction. So Tatiana, if our viewers want to connect with you, where can they find you?
Yeah, absolutely. Please feel free to reach out. I love getting DMs from you guys. You can definitely reach me on my Instagram at the PCOS PhD, or you can reach me on Twitter at my name, Tatiana Alafouzo, all in one word. And thank you so much for having me. This was such a good conversation, and I'm so excited to raise more awareness about this for people with PCOS. And I just love your channel, and you're such an amazing friend. So I feel grateful to have been invited onto your channel. Thank you.
Thank you. I really enjoyed this. If you guys have any questions, be sure to leave them in the comments section. If there's any other topics you guys want me and Tatiana to talk about, let us know. We'd definitely love to do that.
Absolutely.
Yeah, of course. All right. As always, guys, be kind to yourself, be patient, and focus on progress and not perfection. Thank you.
Definitely. Thank you.